Hi, I'm Sienna and I'm hypocapnic. What does that mean? Well, through extensive research and first-hand experience, that's what I'm going to be able to talk about today. So, basically, I have to go over the general anatomy of the respiratory system in order for you guys to really understand what is going on, and then I will go into symptoms, causes, and how to fix this so-called hypocapnia. Well, let's begin. So these are your lungs. And basically hypocapnia is you not having enough CO2 in your system, which is brought about by not breathing correctly. It's chest breathing, some people like to call it. And that keeps the air that you take in just right here on the top of your lungs. It never reaches the bottom, so not all of your capillaries get to take in that air, all the oxygen and CO2 that come from it. What you should be doing is taking in a breath that's more towards your stomach so that the air ends up here, which means it passes through the whole lungs, so you get the most out of that breath. Your diaphragm is very important for this. So that's your diaphragm. And basically, it's the thing that's responsible for breathing correctly. If you're not using that, then you're using accessory muscles, which is not a good thing. They're just for emergency situations. When you inhale, the diaphragm contracts, flattens, and goes down so that it increases the space in your chest cavity to get a bigger breath. And of course, when you exhale, it goes back to the dome shape because it kind of serves to push air out. So yeah, now that you know how that works, I'm going to go into the importance of breathing correctly. So in my interview with a breathing specialist, Deborah, that's her name, she emphasized the importance of having enough CO2. Without it, your pH levels in your blood are completely thrown out of whack. This deters your blood from carrying enough oxygen and nutrients to vital organs such as your brain. That's a big one. So just to name 3 out of many, probably hundreds of symptoms associated with this, it would be like memory problems, heart palpitations, and things like dizziness and numbing in the fingers. And this was derived from Dr. Litchfield in his 2006 journal. Okay, so from first-hand experience, so there's this machine called the capnometer. It basically reads your CO2 levels. And when I went in for breathing therapy, my levels were at a 19-20, and they're supposed to be at a 40 to function normally. Where I was at was actually called severe hypocapnia, and that basically means that my brain was 60% deoxygenated. Yeah, that's a big deal. It basically puts me at the level of mental retardation. They were surprised how I was even awake talking to them. So that just goes to show how crucial it is to have enough CO2 in your system. So, well, after telling you about some of these symptoms and a little bit more about this hypocapnia, I kind of owe you some more insight on what causes it as well as how to fix it, of course. So the causes are stressors. It's big or small. I mean, you can get in a little fender bender and it could throw you off. You can get in a huge psychological or physical trauma and it would throw you off. There's also things such as surgery anesthesia. It works by lowering the CO2 level. That's like they do it on purpose. And some people can't get out of that because your body goes through a physical trauma when you're in surgery, and that's just a double whammy right there. And then, of course, lung diseases and disorders will impede its proper functioning. So, and this was all told to me by Deborah as well in the interview. So many ways you can fix this include managing the anxiety. You basically have to relearn how to do diaphragmatic breathing, and this is through physical therapy for the muscles in that area to let go of the diaphragm, because when you do get into some sort of trauma, your muscles tense up in that fight or flight mode, and for some reason not all of us can get out of that physically, so it stays tense and doesn't allow the diaphragm to move like it's supposed to, which of course causes all the other problems I mentioned before. So that's basically it, and so I think this is significant to know because a lot of medical professionals nowadays do not have a lot of experience with the importance of CO2 levels, and so they typically misdiagnose thinking it's something else when actually all the symptoms that you may have that are present are just due with these CO2 levels being very low. So next time you can bring that up to them if they're having some trouble diagnosing you.